we had a patient. He was known vapor, asthmatic, and he had a surgery done.
And then all of a sudden you might hear code blue, ER. like
Doctors Hospital has reimagined primary care. We've invested to improve our health system, ensuring that accessible, affordable, world-class clinical care is closer to you. Your relationship with a primary care provider shapes the foundation of your overall health. Our new, modern primary care facilities are where critical diagnosis and true personalized treatment begin. With locations across New Providence, Grand Bahama, and Exuma, we invite you to experience the Doctors Hospital difference. Book your next appointment at clinics.doctorshos.com.
Good day, everyone, and welcome to the Doctors Hospital podcast. I'm your host, Eddie Russell, a learning and development specialist within the GLOW office. Welcome to the podcast. We're inviting two of our amazing respiratory therapists here from the main hospital and all over the health system. In this corner, we have supervisor for respiratory therapy, Kristian Sturrup, who's going to talk to us about all of the wonderful things that are coming up for Respiratory Week, which is October 19th through the 25th, right?
Correct.
And then, and the theme is Your Breath, Our Mission. This is going to be fun. In this corner, we also have Britlee Edwards, who is a longer-serving respiratory therapist here at the Doctors Hospital Healthcare System. Thank you so much for joining us today.
Thank you for having me.
We're welcoming you to this podcast because we always want to connect public health issues to what we do within the Doctors Hospital Healthcare System. So thank you all for coming. We've already had our laughs for the morning.
Yes.
I mean, we've already had our laughs in the beginning of this podcast. And so let's just get into what we're going to do. So just for starting at the beginning, what is respiratory therapy? And what is a respiratory therapist?
So a respiratory therapist is a healthcare practitioner that specializes in cardiopulmonary treatment. So we focus mostly on treating the lungs from any aspect, from acute situations like asthma, pneumonia, bronchitis, up to cystic fibrosis, and even up to the critical care aspect of ventilator management where patients are on life support. So it's a wide range of modalities, and we're just passionate about making patients or helping patients to breathe easier.
How did you become a respiratory therapist? I mean, when we talk about careers and health in the healthcare system, we always hear doctor, nurse, and then it stops there. Yeah. We never hear about the other services that surround or other career paths. But how did you become a respiratory therapist?
Okay, I love to tell my story because I was one of those persons who wanted to be a doctor. And I finished my degree, came back home, was on a mission to become a therapist, to become a doctor. And then one day I met this lady named Harriet Lundy, actually. And she was like, Kristian, they're starting a respiratory technician program. I think it'll be great for you to get involved. So I was like, okay, let me go read up on respiratory therapist technician to find out what it's all about. So after I did it, I was like, okay, great, I'll do it. And I just fell in love. And I decided to become a respiratory therapist. I loved the work that we were doing and the outcomes that we had, and just fell in love. And that was like a sweetheart that I never left.
I love that you brought Harriet into it because I think she's the director of laboratory. Right?
I actually did phlebotomy as well. So that's how I actually met Harriet Lundy.
I like that we're bridging the gap.
Yes.
Helping everybody to find what they want to do in the system. How did you become a respiratory therapist?
Okay, so my story is quite similar to Kristian's. I did also want to be a doctor. So I was already in my biochemistry program. And then my dad had a conversation with me. He was like, well, Britlee, what if I cannot fund you all the way to being a physician? How about you find something still in the medical field, because there's a lot of other things. And then once you are finished with that, you can help fund yourself if you want to be a physician. Right. So Sidebar, he was still trying to hint to me, like, be a nurse, be a nurse. This person is a nurse, that person is a nurse. However, I'm a person who likes to be out of the ordinary. I love to stand out.
Mhm.
And nursing, I was like, that is too saturated in the Bahamas.
Right.
So what I did was I looked up schools that I wanted to go to. And then I looked at the medical programs that they offered. So here it is now. I'm on Kaiser University's website. And I started to look at the programs and I saw respiratory therapy. And I was like, what is that? So I started to research, watch all kind of YouTube videos. And I was like, wow, my brother was born with the umbilical cord around his neck. He had to be on the ventilator and in the incubator. And I was like, you know what? This is it. And I started my studies there and I fell in love. I had 1 or 2 challenging courses. And that make me like, I think I should stop. Is it too late to go back? But I love it. I really love it.
How do you become a respiratory therapist? Is it, how long does it take?
Okay, so originally it was a 2-year program. We do have a degree.
Mhm.
So we start off with an associate degree, but they are now converting to bachelor degrees
Okay.
for respiratory therapy. And then we actually sit a board. A lot of people don't know that. They just think that we just have this therapist, but they don't understand that we actually are licensed to be respiratory therapists. So they have a licensure in every state. Unfortunately, the respiratory therapy program is not offered in the Bahamas, so you would have to go to the US or to Canada or to Europe to become a respiratory therapist.
How many respiratory therapists are there in the country? Because it's only a handful, a few of y'all in Doctor's Hospital. How many are there in the country?
We like to say about 10
Like about
that's
10?
actually practicing.
Yeah.
So shout out to the rest.
Yes, we love you.
What does the typical workday look like? I know sometimes I've only seen from a distance what it was when I was in the clinical space. So
Mhm.
and it's literally y'all just coming in and checking in. I don't know what it is when there's a code. I don't know what it is when there's a regular day, when you have like a really, intense patient. Like, what does that look like? Anyone else?
So pretty much some days you will have where we come in,
Mhm.
we look at our patient list. Sometimes it may only consist of persons who require chest physiotherapy, nebulizer treatments, maybe 1 or 2 arterial blood gas sticks. And then all of a sudden you might hear code blue, ER. But your
Real.
day just turns
In a
left.
matter of seconds.
And you're like rushing to the ER with your mechanical ventilator, trying to assist the physicians and the nurses to get the patient intubated, stable. Like it could be from 0 to 100 in a matter of, your shift. Honestly, it's very unpredictable.
I have a question.
Mhm.
And I don't know why I didn't ask this before. As a respiratory therapist, what is your job?
Okay.
Like, what do you do?
So, a respiratory therapist pretty much helps patients to breathe better if
Okay.
you just understand it from the basic aspect.
Mhm.
So, we are in charge of, if their airway is very constricted, it's tight, they cannot get any air in, we try to give them nebulizer treatments.
Mhm.
If that doesn't work, we try to onboard, our higher machines where we'll have we start off with oxygen therapy. If that's not working, then we'll start off with next go to the high flow nasal cannula machine, which will push, oxygen at a higher flow to get that into the lungs.
Mhm.
And if that fails, then we'll have to go to the mechanical ventilator where the physician will intubate them with a tube that goes down their airways, and then we connect them to the machine. And we manipulate the machine, basically giving them a rest. So we take over their breathing for them
Oh
with
my
this
goodness.
machine. So this machine will go in various modes, whatever they seem to synchronize with based on their body type. And we pretty much give them high levels of oxygen, pressure. Um, we control how much breaths they take a minute. Everything is calculated and down to a science. And we manage those machines and make sure, until their lungs get healthy and up to par, then they'll come off of that machine.
I've been in the clinical space for 5 years.
I never understood
And
that.
I
Hey.
never understood that.
A lot of people think that respiratory therapists just give naps. We just put oxygen on. So what Britlee did was touch so perfectly on what our role is as a respiratory therapist. So we're not just walking around with ventilators. We have to understand our patients in order for them to have great outcomes.
So I talked about how earlier we talked about the temperament
Mhm.
because y'all are basically God's chosen.
Oh,
Clearly. Because y'all controlling breath, God controls the
That's
breath.
right.
So
Yes, clock that T, clock that T.
what type of temperament do you think a respiratory therapist need to have?
I think as a respiratory therapist, you really have to be energetic, but you always also have to have a downtime because some of our
Self-care.
cases, some of our cases can be an emotional roller coaster. So understanding how to control your emotions and understanding that what you bring to that patient is going to reflect on their outcome. By that, I mean, you go in there smiling, you have to be positive. For example, just the other day, a patient said she believes she's going to die. I had to hold her hand, pray with her, and just talk. Sometimes these patients, they just need to have a conversation to understand. And they just want someone to listen to them. So being empathetic is major as a respiratory therapist. I don't know if you want to add on to.
I would also say that we are persons who need to understand the importance of not being chaotic when chaos is happening. So,
calm.
yeah, the
The
calm.
breath.
Yes. Yes.
The eye of the storm.
Yeah.
Wow.
Because things can go so south very quickly from when you're dealing with children or adults. And I think it's important for us not to panic because everyone else tend to, be maneuvering so quickly and so fast paced. And then they're looking like airway, like, don't worry, we got this.
Yeah.
And I think that kind of personality trait is important. You have to know how to, control your emotions.
Yeah. So the emotional intelligence.
Yes. Very important.
We got to make sure that's there. Who do you all work with in the hospital? I know directly would be
the pulmonologist. We work with anesthesia. We work with PT.
Yes.
We work with OT.
Yes.
We work with speech. We work with the nurses for sure. We work with the nurses.
Yes.
We work with the surgeons. So basically, respiratory is everywhere.
Yeah.
We have to have a relationship with every single area of the hospital because we work with lab as well. We work with sleep. So we work with every single department.
Every aspect.
What function do y'all play? Like, pick one of those. Like, what function would y'all play with, say, a speech therapist? Or what function would y'all play with the pulmonologist?
Okay. So with the pulmonologist, we pretty much after we come in and assess our patients, our pulmonologist usually will arrive after. So we would have to give him a report as to what's the status of the patient currently, what may have happened if we're on the morning shift, what would have transpired overnight, how is the patient breathing now? Are they stable? Can they wean to lower settings if they're on a mechanical ventilator? Is it possible for them to, graduate to lower settings to try and get them off? Can they even extubate today? Could the tube come out of their mouth? Or even a sleep apnea patient, if they've been on the BiPAP overnight, did they tolerate it? Did they attempt to use it?
Did they try to yuck it off? Did they try yuck up the tube?
Right. Because it is challenging for the patient. So it's important for us to not only treat the patient, but also try to make it comfortable for them. If we say, hey, Dr. Cargo, this patient needs more sedation. They're fighting the ventilator, can you ask the nurse to, increase the sedation? Or maybe, Dr. Cargo, this person is improving. I think they can extubate today,
You had asked one of the traits. So I was just about to touch it. Communication. You have to be able to communicate and advocate for your patient.
Yeah.
So that's very important as a respiratory therapist.
Yes.
So we can have good outcomes.
Wait, so they said that. Listen, I didn't know. y'all giving me an education today, and I'm here for it. Ventilators are often misunderstood. Can you explain that purpose? I think you had already.
Yeah.
You said that they at that third level, if it's
Yeah.
needed, it helps the patient to breathe more freely.
Right.
And then you talked about
So basically, we have settings where the patient is completely, not taking any breaths at all. We have to calculate how much breaths they require based on, we would have done an arterial blood stick first.
okay.
And that blood sample, the results would tell us, whether the patient needs to breathe more or breathe less, whether they need a higher, what we call tidal volume. So if we need to increase the amount of tidal volume they're receiving, if they need more PEEP. PEEP stands for positive and expiratory pressure, and that helps to aid in increasing their oxygen levels in the blood. So that along with their FiO2, do they need more of that? So we have that setting, and then they can, as they graduate to wean off of the vent, they go down to a mode called CPAP, subspontaneous mode, where they're still intubated, but they're taking every breath on their own. And we monitor them for a time period to see how they're coping with that, and if they, can tolerate being extubated.
Does the blood test, the blood stick, that's how you connect with lab, I suppose.
Right.
Yes.
And does that, you say it measures the amount of oxygen that's in the blood?
And the amount of carbon dioxide and also your acidic levels in your blood.
This is really technical.
pH,
This is really
pH
technical.
levels.
So it checks your kidneys as well. So believe it or
Yep.
not, there's some relationship.
Mhm.
When you all typically get involved in the patient care, like when are you called?
We are always called for patients who have any breathing problems, any breathing issues, like example, asthma, or like Britlee said earlier, cold blues. We are automatically involved right away. We are also called when someone has surgery. Part of our job is to help with the post-op recovery.
Okay.
To make sure that you don't get pneumonia.
Okay.
So we don't want any setbacks. And basically, peds patients who have asthma, we are big on education as it relates to asthma. That's part of our respiratory specialty.
I was just about to ask, what role do you all play in terms of asthma? Because it's kind of prevalent in the Bahamas.
Yes, it is. So when we have patients that come in with asthma, most of the times we're giving the therapies, reassessing, see if they need more therapy. We also do something called a peak flow. And with the peak flow, we have been very big on this now recently, especially with our cases. We've been seeing a lot of asthmatics as of lately. So we've been educating those on what a peak flow is, why we do it, and when you should do it.
Okay.
So basically, the peak flow will tell us your severity. It kind of helps to say what your airflow is in your lungs, because asthmatics, one of the things is their chest gets tight, so they can't get the air in and out. So the purpose of the peak flow is to say, listen, it goes red light, yellow light, green light. So green means you're good. Yellow means, okay, time for you to call your doctor, say something's up, and stop means go to the ER right away. So we've noticed that this has been helping with the management of asthmatics. Sorry.
I think let's just take a moment to breathe. Teach me how to breathe.
Breathe in through your nose and out your mouth.
Yep.
Isn't that relaxing?
Yeah.
That's what a respiratory therapist do.
Yes.
So if you could create a public health campaign for the Bahamas, what would it focus on? Because I know there's smoking, there's vaping, people love hookahs. I used to do hookah, and it breaks every single time, which means that
you should not do
I
it.
should not be doing
That's
it.
correct.
That is definitely
It
a
always
sign.
the bowl always breaks,
Oh,
and I gotta throw it away. So I've given up. But
we love
what
that.
public health campaign would y'all launch if y'all could press the
We would definitely advocate for people to stop the vaping, stop the hookah, and stop the smoking.
Yeah.
why?
Because your breath is our mission.
Which is a theme for this which is a theme for this month's respiratory week. So stay tuned. It's the 19th and the 25th to the 25th.
But you said what?
Did you say what?
You still want to continue with the why?
Yeah.
Okay. So I would say, for example, we have noticed that those who have been vaping, it causes hypersensitivity in the lungs. And that could trigger your asthma. And when you become hypersensitive, it makes it harder for you to breathe. And if you do have, for example, we had a patient, he was known vapor, asthmatic, and he had a surgery done. And as soon as the anesthetic was given, he was unable to, he would not ventilate, which is where they'll get the air in and out because of the hypersensitivity of the vaping on the lungs. So what ended up happening is he became asthmaticus, which is severe asthma. We had to keep him on the vent, get the airways open, and that is how we were able to get him off and able to breathe again. So that's why I was saying that the campaign for us would be for real: stop the vaping, stop the smoking, and stop the hookah.
Noted. Where do you see the profession heading in the next 5 years?
In the next 5 years, I hope that we'll have more respiratory therapists, and us being very dominant in every area, even in the outpatient clinics, making our presence known throughout the Bahamas and just bringing more on board. I see us offering more cutting edge therapies as we continue to grow, which would improve patient outcomes, bringing the newest technologies back to the Bahamas, as we are the best high-tech, high-touch providers.
I was just about to ask, what sets respiratory therapists at Doctor's Hospital apart from the rest?
Yeah.
Run the tape.
You touched on it.
Run the tape. But you did. What the career opportunities exist in the field of respiratory therapy?
So you have respiratory therapists who can be specialized in sleep medicine, respiratory therapists who are specialized in asthmatics, in asthma care, asthma education, smoking cessation, trying to campaign for persons and help persons to quit smoking. You also have specialties such as PFTs, pulmonary function testing, and that is very popular for patients who are about to have surgeries or who have probably came over a very chronic illness or have been on the ventilator long term. If you want to test, the status of your lung health. So that basically will tell you if you're fit to have surgery or help the anesthesiologist on how to manage your case during surgery, And then you also have specialties such as home care, outpatient rehab, following the patient all the way, not just in the hospital, but also following them home to make sure they're guaranteed a positive and successful outcome so that they don't relapse.
Okay.
And we're also on flights. Respiratory therapists are always involved in the critical care flights.
Yes. Air ambulance services.
Y'all everywhere.
Yes, we are.
Everywhere. Well, the breath is everywhere.
That's correct.
When you think about it, it makes sense.
In Canada, they actually call for respiratory therapists before they even call the physician.
Wow.
So they're considered as important as physicians. So they also do take over intubations full on, and then, the physician will come in after, pretty much micromanage. Yeah.
That sounds so interesting that they would be the first to be called. I think the stabilizing of the patient with the most basic modality or most basic treatment or care would be to return the breath. Let's get the breath going first, and then we'll deal with everything else. Right? It's very interesting. I tell y'all, y'all giving me a lot to think about. I wish I had known about this. I think I'd be a good respiratory
That's
therapist.
why we're here today, to get it out there.
Yes. And we're welcoming a lot more.
I think we touched on the types of patients you commonly assess, but could you do that again for us? Anyone? The type of patients you see and treat.
Okay. So we see asthmatics. We would see post-op patients. We also see patients with cancer. They're part of our services as well. We would normally see peds patients, whether it be for asthma, not only asthma, pneumonia, or any viruses that may be causing respiratory issues. We also see patients with COPD, which stems from those having smoked for years. We also see patients with sleep apnea. That's very common. And we also see
COVID-19. We're very present for that era.
the warriors of
Oh,
COVID.
yeah. The unsung heroes.
Yes.
Patients who have emphysema. Patients who, and like Kristian said, pediatrics, neonatals, up to the elderly.
From birth
We
to
treat right.
from birth. You have a place if
Yeah.
necessary.
Yeah. Every department.
You talked about COPD, and I understand that there's a rise of it in the population. Could you speak to that?
Okay, so COPD is chronic obstructive pulmonary disorder. And we are seeing a rise because we are now seeing those who may have smoked 10 packs a day for years. Just for example, they are now having issues with their lungs where they can develop chronic bronchitis or emphysema. So with emphysema, for example, it's when your lungs are overstretched. And if you have chronic bronchitis, that's because you're just producing secretion. So a lot of the smoking tends to take off the lining that allows our lungs to stretch. So with emphysemic patients, their lungs stretch, but they can't retract back to normal size. So that is why we are so important for them, because we're helping with the therapy to get their lung to the level where it needs to be. So with the treatment
at Doctor's Hospital, I think I want to touch on that as well.
The treatments we would normally do with doctors. So basically
What services offered?
We offer our respiratory service, for example, would be like, we have a device called a MetaNav. There's nobody else that's using it in the Bahamas, just to put it out there. Just the WOW service,
Right.
Doctor's Hospital, Respiratory Therapists.
What does it do?
Basically, it gives chest PT as well as inflate the lungs. So if your lungs are stiff, it helps to inflate the lungs. And you also know how to do a therapy properly. That's why only respiratory does it.
I'm sensing a thing.
Yeah.
They love it.
Yeah, so that's one of the things, and it makes it easier for the patients because sometimes they don't want to do the incentives, but they see the red ball come up. It's boring for them and it's uncomfortable.
Right.
So we offer these different modalities to make it easier for the patients to have good therapy. So that's one of the things that we can do. So it's opening your airways as well as clearing secretions at the same time.
While delivering your nebulizer treatments.
At the same time.
So 1, 2, 3.
One shot.
So would somebody typically come to Doctor's Hospital just automatically or just randomly seeking the service of respiratory therapy, or no? Or they have to be admitted or at some point been in the system for something else? Or is it something? Because I would want to breathe better. I would want to sit down and have oxygen pumped into my the bariatric system, right? But that wouldn't be something.
At this present time, no. We're basically inpatient at this present time. But I do know in the next few years, we will be outpatient eventually.
Looking forward to that. I'm sure the rest of the country is looking forward to that as well.
Yeah.
We've had a really beautiful conversation with these two amazing respiratory therapists here at the Doctor's Hospital Health System. Just a FYI, the Respiratory Awareness Week, is that what it's called?
Respiratory Care Week.
Respiratory Care Week is October 19th through the 25th. And the theme is Your Breath, Our Mission. Thank you all for coming on the podcast. I had a really good time today.
I had an amazing time.
Wow.
Please stay tuned to all of our podcasts. Look out for this one. And we just want to wish you all a happy Respiratory Care Week.
Doctors Hospital is pleased to announce our ambulatory surgical center located at Centerville Medical Center, number 68 Collins Avenue. This state-of-the-art facility offers outpatient same-day surgical services. Our team of skilled and attentive nurses, technicians, and administrative staff are ready to serve you and provide the highest quality care while offering competitive pricing in outpatient surgeries. Patient benefits include online pre-registration, pre-surgical screening, and anesthesia evaluation and clearance, all in a safe, COVID-free environment. We're open Monday to Saturday from 7 a.m. to 7 p.m. If you have questions, feel free to contact us by phone at 302-3260 or by email at surgerycenter@doctorshosp.com. Doctors Hospital, trusted and best care now. Isn't your health worth it?